first I would like to ask for your permission to use this video for educational purpose.
Absolutely, yes.
Thank you. Now tell me, what were your symptoms before the surgery?
My main symptom was this horrible wraparound pain that I would get from my center upper back all the way around into my chest to where it was hard to breathe. I mean, the pain was outrageously
How
bad.
long did you have that pain?
Oh, at least a year it would come and go, but before my surgery actually happened, it was getting much more frequent.
Yeah.
Yep.
1 to 10, how bad was that pain?
Like a 20.
20.
I mean, it would make me lay down wherever it happened, like on the
Yeah.
floor, on the ground, or anything, and I would just have to wait for it to go away before I could do anything.
I'm going to just turn and show what surgery we did. We did a direct thoracic interbody fusion with minimal invasive technique. And this surgery, actually, we did it with multiple smaller holes. And here are the screws and the cage and the spacer. And if you look carefully, actually, it seems that the bone is growing already, which is good thing. But the only thing unusual about that is the surgery. Here it is, that there's a hyperintensity, what we call it, like a bone density material growing from one bone to another here. This is a good thing. The only thing is that the surgery was when?
May 17th of this
So
year.
about 3 months ago.
Not quite, yep.
Not quite.
Yep.
So we never see bone fusing in that short period of time. That's almost unheard of
Okay.
for the bone to grow. But here we sort of respect all the vascularization of the bone. That's why the bone is growing so
Okay.
fast and so good. But how have you been doing since the surgery?
You know, at first, like the first 2 weeks, the healing pain, it was, I'm not gonna lie, it was really bad.
Yeah,
but
yeah,
compared
realistically.
to that wraparound pain, it was nothing.
So how is that wraparound pain now?
The wraparound pain, I haven't had it since the
Excellent,
surgery.
Excellent. Now,
Nope.
so you woke up and that was gone?
Yep, I woke up in the hospital, and since that day, I have not had that pain once.
Okay, now it's a while back, but do you remember the surgery itself? Or how long after the surgery did you walk?
I believe it was right around that 4-hour mark, maybe
4 hours.
maybe a little bit less.
Yeah, and
Yeah.
how long did you stay in the hospital?
Just overnight. The next
Just
day,
overnight.
the next day, I got all my therapy stuff checked off.
Yeah.
Walk up the stairs and stuff, and I was
Yeah.
out.
And I have actually here the record of the surgery that shows your surgery took actually only 53 minutes, and our blood loss was only 39 cc, which is really nothing. We used to do these surgeries, we cracking your chest open and just keep you a good part of a week in an ICU with the chest tube in replaced. So I think that we are not completely healed yet, even though the bone is growing. Certain activities still will be painful, and I'm sure you noticed that.
Yep.
But I think we are on absolutely right track in the shortest amount of the time that's possible to
Oh,
get
yes.
on the right track. So how is your daily activity these days?
My daily activity is getting a lot better. I can, bending is still kind of hard for me to do. I think that's like the one thing that, I'm still struggling with. But, I get up in the morning, I move around, cook breakfast, do everything that I used to do.
I'm happy that the result has been so good for you, but I think what's even surprising for me and my colleagues who are specialists in that we have this kind of result just about less than 3 months after the surgery.
Yep.
That again, we have a bone growing back. I think that's a tremendous amount of improvement of what's out there with the open surgery. Well, thank you so much
You
for the
bet.
interview.
You're welcome.